Atrial fibrillation is a very common cardiac arrhythmia. The normal rhythm is called sinus rhythm, and we have about 70 beats per minute in a regular pace. But in atrial fibrillation, the rhythm is very irregular and very rapid, and patients can have symptoms like palpitations or shortness of breath. And some patients don't have symptoms at all. We have risk factors like high blood pressure, diabetes, for example, sleep apnea, obesity, or an inactive lifestyle are really important risk factors that need to be addressed in the comprehensive management of atrial fibrillation. Best practice in managing atrial fibrillation is actually really looking into what are the guidelines telling us, what is the evidence, but also aligning that, what are the preferences, the needs and the values of the patient to really make it as tailored and individualized as possible. For the patient, we've developed an educational app where we provide patients with education on what is atrial fibrillation, what are the symptoms, what is a stroke, and why is it important to look into risk factors and lifestyle. So if you think you might experience atrial fibrillation, that can be very obvious by palpitations, or you might be having symptoms like shortness of breath or being tired, very tired all the time. Just talk to your GP, because they might ask you further questions to look into further symptoms, and they might do an ECG to really look into the heart rate and the rhythm to identify if atrial fibrillation is present at that moment.